In Barbados, we're faced with a rapidly aging population. One of the things that we're seeing is that the proportion of individuals over the age of 65 is increasing, particularly relative to those who are in the working population. And these numbers are projected to increase. Not only the over 65s, but as we project out to 2100, we actually see that the population above 80 is projected to increase the most. This has implications in terms of pensions, but it also has more direct implications for health in terms of the need for rehabilitation services, as well as the need for other aspects of long-term care, including institutionalized.
The government's long-term care facilities, which is concentrated in 4 district hospitals. Between these 4 facilities, we house approximately 540 older persons. We are currently experiencing an increase in the number of referrals for places within these institutions. And over the last 3 years, we've seen a growth. We're still not able to meet the demand of persons who are requesting or requiring placement in the long-term care facilities. There has been much debate as it relates to community care, providing care for older persons within their own homes in the community. And this is an area of potential investigation.
We're seeing a number of persons in Barbados with dementia, not just of age, but younger persons as well. We have no estimates, but the last one we had was back in 2014, and that gave us about 4,087. Now this is 2019, and I can see a crisis on our hands. Right now, we have, as you know, this was World Alzheimer's Month, and we have so many people calling in with dementia, and I'm not quite sure how we're going to deal with the problem. One thing I would like to see is more education with families and teaching them how to actually take care of themselves as well as taking care of the person that they're responsible for. Well, I would like to see more doctors involved. I'd like to see them more trained. In terms of the nursing, I'd like to see more nurses involved as well, because that is vital, especially if you're going to have these people in the institutions. We need to train them and teach them properly what they have to do and how they have to care for persons with dementia.
Barbados has an aging population with diverse needs, capacities, and experiences that will shape the demand for social services. Some older persons, because of their socioeconomic status, would need more social support. Others who want to maximize their involvement in society will need less social support, but more programs geared to active and healthy aging. At the National Assistance Board, we will continue to provide community-based services to support persons remaining in the community, such as home care, recreational activities programs, transitional shelters, senior citizens village, and also social work services that persons can access services if they need to.
We are here in Barbados trying to do this exercise, workshop around how we could transform the health system capacity to respond to the older person's needs. That is part of the work that the World Health Organization are doing in the last 2-3 years after it was approved the plan of action, the global plan of action in aging and health. This plan of action have a 4th global objective, and one of them is try to improve the aligning of the health system to the needs of older persons.
Some of the things that we found, you might say, well, this needs a little bit of tweaking. This is not the real picture. But remember, when you take a snapshot, you always have to refine it, because that not always gives you the wider picture. So that is the role of these 2 days, that you will be refining some of that. But more importantly is what happens next. Because what we want to use that snapshot for is to see how we inform policy.
Ultimately, Ministry of Health is going to use the outputs from the 2 national consultations that we would have had with the stakeholders across the elderly care sectors, and with the inputs from PAHO to pull together a plan for not just reacting to, but anticipating and making sure that we can meet the needs, particularly the long-term care health needs for our aging population.